Each year we celebrate the birthday of Florence Nightingale on May the 12th as International Nursing Day. This year the theme of this day is Our Nurses, Our Future. Coming out of the pandemic, perhaps, we have come to realize how true this is and what a critical role nursing plays in delivery of healthcare the world over. Pakistan faces a tremendous shortage of nurses and over the last several years has invested heavily in trying to improve training opportunities as well as the number of places available to train nurses each year. Nonetheless, it has been estimated that we are short of perhaps up to 2 million nurses in this country. It is a sad fact that a number of nurses that do train in this country are lost each year to better economic opportunities in the developed world. This is clearly something that we need to address going forward. At the Shaukat Khanum Memorial Cancer Hospital and Research Centre in Lahore and in Peshawar in Pakistan, where I work, we provide tertiary level cancer care services to all our patients, irrespective of their ability to pay. Nursing is clearly key to delivery of cancer care, and we are immensely proud of our nursing colleagues. The theme of our fundraising campaign this year has been Help Us Ease the Burden of Cancer. We have tried to highlight the fact that cancer affects not only the patient, clearly, who has symptoms from the disease and who has to suffer the side effects of treatment, but also the patient's family, whose lives are disrupted as a result of the diagnosis and treatment, members of the family who are wage earners, who often have to travel with patients, sometimes long distances, in order to access treatment, who have to stay with patients, sometimes for months at a time, a long way from home, so that treatment can be completed. And nursing is clearly integral to all parts of cancer care delivery, starting from diagnosis all the way through treatment to palliative and supportive care, all of which are aspects of care that we provide. I recently spoke to one of our patients who had been in hospital for a diagnostic procedure. She told me that she was extremely anxious about the procedure beforehand, and particularly so about the fact that she had to have an intravenous cannula inserted. She said she was so relieved when, during the process of cannulation, the nurse told her that the needle had been removed and there was just a little piece of plastic in her hand now. This seems like a small thing, but it was indicative of the effect that nurses can have on patients and how a little word of comfort can go such a long way in allaying patients' anxieties. As we come out of the pandemic, it has become customary to thank healthcare workers in general and nurses and doctors in particular for the hard work that they put in selflessly in order to look after those affected. It is time that we put in more effort to actually trying to improve the working environment and opportunities for our nurses, to improving opportunities for their academic and professional advancement, to removing societal and other barriers which prevent people coming into this profession, and trying to optimize the working environment so that patients can continue to be the priority for all our nurses in years to come. Thank you.